Okay, good job. You remembered. So,
Thank you. You had to
this
remind me.
lunch and learn with Dr. Wolf. So it's really nice to see a lot of people that are in Palm Health's network and also Community Greening's network, and that's really the purpose of this, of connecting trees and health, connecting leaders in the community, decision makers, community organizers, people to really just kind of start seeing these connections and learning from national experts like we are today to make Palm Beach County a better place to live, a better place for families, for kids, for all the things of having a healthy community. And that's really why we started Community Greening in 2016, was because people were concerned about trees coming down. That was in Delray Beach, and so it was like, okay, trees are coming down, palm trees are going up, we're losing green spaces, we're losing canopy trees. What can we do about it? And so it was really with a diverse board and just advocates in the community that were like, let's start a nonprofit instead of trying to pressure the city to constantly pay for these things, to pay for trees. Let's start a nonprofit and we really engage the community to plant and care for trees and learn about the importance of them. And that's really what we were able to do. And we did that by really tapping into this nationwide network. So when we contacted the Arbor Day Foundation, they were very supportive of us to really have a place in South Florida. There was no one really doing this for a long time. I think that's part of the reason why we are losing tree canopy, is because there really wasn't a concentrated effort from the community to plant trees. Like in places like compared to Atlanta or DC, where there really has been this organized effort backed by corporations and cities and universities for decades, and they've really maintained their tree canopy, whereas we haven't. We keep losing green space. So in tapping into that nationwide network, we quickly learned of people that have been doing this for decades, but we also quickly learned that South Florida is losing green space faster than most other places in the country. Whenever they put up a list of places, we were always in the top 3, top 5 of places losing, the value of green space. And we also learned that trees aren't equitably distributed. So, it's called tree equity. There's much more tree cover in areas that are more privileged than other areas. And so it's the story of race and income when you're looking at tree canopy coverage. So whereas like a certain neighborhood in Delray Beach might have 44% of their land mass covered in trees, you go out to Belglade and you're at 4%. Or even within Delray Beach, you might be in the Southwest neighborhood and they have 14% tree canopy coverage. Whereas, just a mile down the road, it's like the whole thing about show us your zip code and then we'll tell you about your life expectancy. It's very much correlated with tree canopy and race and income. So if you're learning about all these things and it's like trees do things for us, there's many benefits of trees, and that, as far as extreme heat, we're talking about in South Florida, flooding, cleaning the air from air pollution, all the mental health benefits of having a green space near your house, even then connecting to physical activity, then you're thinking that there are certain areas in our communities that have much fewer benefits than other places. And so from the very beginning, we've just focused on those areas. We say planting trees where they're needed most, and in order to increase the benefits. At the same time, we'd go to these conferences nationwide, and it was always eye-opening because there'd be 500 people there. There'd be people from around the world, and all of these different projects going on. The National Institute of Health funding planting trees along highways to reduce heart disease, and there's these big projects, and you come back here and just kind of wish that all of us who are on this call could have been at that conference. That kind of feeling of like, I hope we can do this here. And so that's why this is really exciting for me today, because it feels like it's something we've been working on for a long time to really have our community hear these messages. And so that's when we started working with Palm Health and, and really working in the Glades area to get our programming out there, and then partner with National Wildlife Refuge Association and U.S. Fish and Wildlife Service, Florida Forest Service, all of us really trying to work together. It's like we were hoping that we could also get this message of trees and health to all of you. And so this is the start of that, really reaching out to Dr. Kathleen Wolf, because really at these national conferences and international conferences, when you're talking about trees and health, it's Dr. Wolf who's the one who's delivering that keynote presentation on what are places around the world doing, and what does the research show when you are looking at both, the environment and public health. So that's why this has just been like a great opportunity to have all of us here together, and it's a privilege and honor to partner with Palm Health, and also to introduce Kathy Wolf to all of you who are working to make this community better. And hopefully this kind of starts the conversation and make some connections on how we can, bring some of this and push it further along in South Florida. So without further ado, I'd like to introduce Kathy Wolf and thank her for joining us today.
Hey, Mark, thank you very much for the introduction and really, more importantly, sort of setting the broader context of why we're all here, what our goals, your goals and aspirations might be, and then what I might bring to or complement or supplement some of the conversations and actions that all of you are considering with regard to urban forestry and nature, what I call nearby nature, more generally in communities. Let me just jump right into slides. The structure of this is, I'm planning on talking maybe 40-45 minutes, but I'll take little breaks after different sections within my talk. So if you have questions that you want to put into chat, or if you want to raise your hand during those breaks, and just we can talk a little bit. And then, to my understanding, we do have a little time following that if people want to stay on for more follow-up discussion. So on to the slides here. So I'll start with a document that was shared with me when Mark and Abby first reached out to me. And it's a tree canopy report for one of the communities in the Palm Health Foundation's region, to my understanding. And very good graphics, good illustrations of the need for tree planting. And this particular report focused on two issues or two concerns that have serious health implications. First was air quality, and the second is heat stress. And what I hope to share with you over this next hour-ish is to expand that dimension, or to expand the topics that you might think about of health, that is human health, that is related to tree planting and canopy cover and so on. But what I want to say up front is, Mark spoke about interacting with other people, other organizations across the country that are nonprofit, as well as government agencies that promote tree planting. And what we've seen across decades of urban forestry best practices is that connection with community is absolutely essential. And in part, you need community support to initiate planting programs, to actually get the trees in the ground. And then there's the long game, stewardship. If a crew comes in from a government agency or a contractor and drops in trees in a community, there's not that connection. There's not that sense of place, that sense of belonging that accompanies groups of people, particularly youth, that are involved in planting those trees, and then perhaps caring for them both politically in terms of ongoing budget support and whatnot, but also personally, and perhaps being a part of stewardship programs. And I understand that community greening is focusing quite a bit on youth career development or jobs training programs. And that just starts to set up a trajectory of not only employment, but again, caring for your nearby and home environment. These sorts of jobs can't be exported to other countries or to other regions of our own country. These are place-based and community-based jobs that are very, very important for a variety of reasons, including health, which I'll now launch into. A little bit about myself. I'm from the University of Washington in Seattle. I am semi-retired, that for about a year now. So that's been quite a journey. And I have been, I come with a background as a social scientist in environmental psychology. So my career started out as a biologist, and I actually worked in Key West, Florida for the city of Key West for 5 years early in my career. And then went on to grad school to become a landscape architect, but took classes from people who were early on pioneers in environmental psychology. So that's kind of my grounding in all of this. I'll start with what is recognized as kind of the first attention-getting study about nature and health. And this was done by Roger Ulrich in the 1980s. And he did this kind of a natural experiment. There were people recovering from gallbladder surgery, and they were randomly assigned. They had no choice. They were assigned to a recovery room, and some of them had a view of a brick wall, and some of them had a view out a window to a tree, an area. And here you see the results of that study. People who were seeing green, shorter stays. They went home. They healed more quickly. They went home more quickly. They expressed less pain, and that was supported by less analgesics, less pain-killing medications, fewer minor complications, and the hospital staff judged that they were a better emotional well-being during this recovery process. Well, those studies have continued. Roger's colleagues, students, as well as other people have continued in finding fairly consistent results to the point where hospitals are now incorporating green space in their design or remodel projects. Here's an example from Massachusetts General. This is a neurosurgery recovery area. And to my understanding, I'm not from the medical field, but to my understanding, someone who comes out of that surgery needs pretty close monitoring for an initial period. So what happens is as that person recovers, they turn the bed around and you see the technology stick there, the vertical stick, then they turn all that around so the monitoring can continue. All of that then is turned so that that person is looking out into a green environment. And that's very intentional. And I'm seeing more and more hospitals incorporating these sorts of possibilities in that healing process. So here's an overview of the slides that I'll be sharing with you, the ideas that I'll be sharing with you. And I'll be talking not only about my own research, but really the findings from a community of science that now spans the entire world. The pace of publication with regard to health experiences, nature experiences and health is just growing rapidly, and more funding is coming to it. So it's very encouraging. And we're at the point, we're sort of at an inflection point where organizations, medical and public health officials, city government officials are starting then to incorporate this work into policies and programs concerned with urban design and urban planning. So here are the three pieces I'll be talking about. One is a research overview. You know, whenever we talk about urban trees, we talk about tree canopy, that high level look down. I'll start with some research reviews that are similar in terms of the research that we have out there. And then I'll focus on mental health. There's so many topics I could talk about in an hour, but because of the prominence of interest and response with regard to mental health for a variety of reasons, the pandemic, all sorts of other things, I'll speak about that. And then I'll turn to environmental justice, which Mark spoke about a little bit, equity, and some ideas then in how that might infuse and be a part of ongoing urban forestry activity. All right, first of all, about a decade ago, a little longer now, the Forest Service contacted me and said, you know, we're starting to hear about this nature and health research. Would you be willing to do a review? And took that on. It was quite a complicated project, assembling articles, reviewing journals, several great graduate students that helped with that. And what we put together was this website called Green Cities Good Health, and it's up and available. And if you go to the website, what you will find is about a dozen topics there on the left, and those are the themes, if you will, that represent clusters of these peer-reviewed articles. And then for each of those, there's a very short introduction, fast facts, some of the statistical highlights that we found across the articles. And then what follows is a much longer essay that offers more detail about these findings. Many people have told me, so university instructors, high school instructors, city officials, nonprofit organizations, as they're bringing their staff on board, have told me this is a great introduction to the topic. And I just received word from the Forest Service recently that we'll be refreshing this. We'll be updating it with the more current research. But it does, even though it's a little dated, it still serves as a wonderful overview, or so I've been told. And those fast facts are wonderful for dropping into newsletters or into grant proposals. So it's all public information. Plagiarize all you want. That's what it's there for. Then more recently, I took on a review of trees in particular, urban trees and human health. And this was a very satisfying activity because it was a collaboration with colleagues in the Forest Service, Health Canada, a University of British Columbia, a variety of organizations. And so what we did was here you can see the associations or affiliations of people, as well as a very diverse set of sponsors for the work. And what we did then, and by the way, there's no paywall on this article. It's open access. So if anybody would like to pull that down and take a look, it is available. That reminds me too, if you'd like, I can share these slides when I'm done, because I'll be going through a lot of content pretty quickly. And if you'd like to go back and look, take a deeper dive and look at some of these things, then you'll be able to go back and find those references. Typical of an academic or scholarly review is you enter keywords, titles, ideas into a search. You get typically thousands of articles. Then you review by title and abstract. That tends to winnow down the collection. Then you do a science quality assessment, and I'll talk a little bit about that in a minute. And that further takes down the number until our final article set was about 201 studies. And then the real work begins, and that is to synthesize across all of these different articles, all these different studies, what are the prevailing themes? So here is one level of message. One is that having green in our environments reduces harm. And the Belgrade study really tapped this. It's reducing air pollution, reducing extreme heat is the focus of that report. So reducing harm, reducing those circumstances that can influence human health in both direct and indirect ways. But then there are two other health promoting processes associated with trees that resonate more with my work, and that is restoring capacities. If you're ill, not feeling well, having time in nature or having nature surrounding you can help to restore those fundamental health capacities, physical health as well as mental health. And then nature helps build capacities. So it gives you a little extra margin of benefit that can then play out in improved health over time. And one example of that is we're now finding that across the world, there are numerous studies showing that women who have more canopy around their homes, pregnant women, their babies are likely to have better or higher birth weight. So that is really building a capacity. A child that is of healthier birth weight is set up not only for near-term better health, but potentially better performance in school, even playing out into middle age and cardiovascular disease and so on. So these are three very kind of top level messages about what we saw in the Trees and Health review. All right, digging down one more level of detail here. Building capacities, you see social cohesion, birth outcomes, enhanced immune system, weight status, people perhaps with more green around them, more likely to be engaged in physical activity, perhaps better weight management then. Restoring capacities, having to do, and I'll be talking a lot about that because you see in the restoring capacities a lot of mental health and mental wellness implications, and then the reducing harm. So what those bars represent there are the number of articles representing each of those topics. And within the bar, you see positive, consistent positive outcome, mixed outcome, because many of the studies use multiple measures. And sometimes the measures detected a change, sometimes they didn't, or sometimes they maybe even indicated a negative outcome, which is something I'm quite interested in, and how do we understand that and perhaps address that more directly. I want to call out something because some of you I know are part of medicine and healthcare communities, and take a look at that bottom bar, tree pollen and VOCs. What we discovered was, all right, these articles represent publications in many different disciplines: geography, economics, psychology, sociology, landscape architecture, sustainability, all sorts of different journals. What we found was the journal listservs that serve doctors, nurses, healthcare providers don't include a lot of this science. But what we did see was a prevalence of pollen issues in the medical journal arena. So yes, tree pollen can, it could be an allergen, might influence respiratory concerns. Urban foresters now are recognize that and attempting to address that by way of tree choice and where trees are planted in relationship to, say, children, concentrations of children, such as schools. But I think it's really important to recognize that a lot of these other health outcomes, many of them positive, are never included in the information that healthcare providers and even public health officials might receive. So I find this is a wonderful opportunity for me, and I'm finding there's more and more opportunity to share what we've learned and what its implications are for those people who directly, those professionals who directly deliver and guide people in their health and wellness. Okay, very high level messages, because sometimes people, you know, Kathy, I'm not going to share charts and this article that's no fun to read. So it's like, okay, what are some top level messages? Here's one. We found that trees, presence of trees in people's everyday environments can promote general wellness. So again, the building capacities, promoting wellness by way of direct and indirect influences. But then we also found a collection of articles that if you're diagnosed with a particular disease or disorder, that there are nature therapies and treatments that don't completely alleviate or eliminate that, that condition, but they can help as a partial remedy. And those two different dynamics, I think, are quite important. Here's, excuse me a moment. Another high level message is we found across these articles and Green Cities Good Health, the entire life cycle. It's important for people to have nature in their surroundings, nearby nature. I mentioned the baby, the infant weight studies. So from the very days, in fact, there are studies now, I'm starting to see a trickle of studies about the influence of green on the mother's health while she's pregnant, and also immediately postpartum depression influences, positive influences. So from the very earliest days of our lives, adolescence, young adulthood, middle age, and right on out to our the very last years and days of our lives. Interesting work now being done on older people and dementia, Alzheimer's, cognitive disorders, and the role of having nature in your environment. So cradle to grave, or human life cycle, the importance of having nearby nature for health and wellness. Here's another high level message is we're starting to see, not only in the review, but in the broader literature, is yeah, okay, so if you have some sort of expression of nature, we're talking about tree canopy and the presence of trees, for instance, and then some sort of health outcome that's selected for the study. But people are asking, well, what about dosage? You know, like say equivalent to a prescription. How much? How often? Is it different for different ages or people? And that is being studied now. So you see across these different citations that I have here, kind of a general consistency starting to emerge, and that is it appears that 20 to 30 minutes per session is really valuable. I've seen some studies that say as little as 5 minutes in time outdoors, if you've been at your desk, or indoors for a long time. 5 minutes can be valuable, but I don't think the effect is as durable. In other words, it doesn't extend long beyond that brief time. But here we see stress reduction, improved depression, improved blood pressure, and so on. And then how does that tally up across a week? So not unlike the CDC's recommendations for physical activity, which is now about 150 minutes a week, maybe you combine that physical activity, instead of in the gym, it's outdoors. And you get then a double level of benefit, the physiological movement, as well as then what other physical and or mental benefits associated with being outdoors. So dosage is something that's more prominent, becoming more prominent in all of this science. The culmination of all that is this term of social determinants of health, which I detect is quite important now, locally, nationally, even internationally. The World Health Organization addresses social determinants of health. And whenever I hear people speaking about this, they often do not include nearby nature as one of the elements. So, you know, those of you familiar with this term, you know that so often the general public thinks of health enhancement as personal decisions, what food one eats, organic or not, water that you drink, personal decisions about exercise. But as Mark said, we have learned that your zip code is indicative, can be indicative of life expectancy and various health conditions. So nearby nature is part of this ring, part of this expanse, if you will, of social determinants of health. And I continue to try to introduce that into discussions about this dynamic. Another thing that we're seeing in the research literature, it didn't pop up quite so much in the trees and human health, but supply and demand, economics, yes, that determines price. And in the healthcare industry, there's incredible attention to the economics. Supply and demand is fairly complex with regard to pharmaceuticals, care facilities, and so on. But what we're seeing now, most recently, absolutely in the last year or two, are some efforts to discover the economic value of having nearby nature. And this was a study that was done in Northern California in collaboration. So the people who do the natural resource remote sensing and detection of greening paired up with Kaiser Permanente. And they found then for those having a lot of green cover around their homes, an annual healthcare cost reduction. It's not a lot of money when you consider that the average cost per capita for healthcare in the United States is hovering around $11,000. So it's not much, but if you roll that up across an entire city or even a neighborhood, you start to see perhaps some cost offsets that might be dedicated then to urban forestry, that might be investments that insurers or healthcare networks might be able to afford and encourage. All right, that was a quick overview of research. And if you'd like, if there are questions, let's spend a little time on that before I move to the next section, which will be mental health.
Wonderful. Thank you so much, Dr. Wolf. We have one question in the chat, and Dr. Alonso has her hand raised. Dr. Alonso, you want to come off mute, and then I'll read the question.
Yes, as a retired former health officer, I can't help but say that we have always used health in all policies. And I think we've been somewhat successful in planning and always sticking our nose out. But lately, we have seen a decrease in attention being made to the suggestions that we're making. And with the change in especially in the county's makeup of the county commission, I project that this is going to be even a bigger problem. I've been a resident of Palm Beach County since I was 5 years old, and I have seen, a total elimination of green space all over all of South Florida. So, if you go down to Miami, it's just very, very sad. I would not have gotten through COVID if it wasn't for my backyard. So I am a perfect example of, yes, green space is a very good mental health and physical health proponent. I would like to suggest that Lakeside Medical Center was on purpose built with green space with this in mind. It would be really exciting to have their residents who are family physicians training to be family physicians and hopefully staying in the area to perhaps duplicate a study, something like this, in terms of their patients who have access to green space. And so does the Ed Healy Center, that is the nursing home that the county has under the healthcare district. So if someone wants me to go out and reach out to them to see if this is a possibility with under the auspices of Palm Health, I'd be happy to do so.
That is great, Dr. Alonso. I did not know that about Lakeside Medical, and community greening is spending a lot of time in the Glades communities. So I would love to follow up with you on that point.
May I offer a couple of comments?
Please.
Yeah, Dr. Alonso, thank you so much for, I often feel that I sort of drop in with these slides and ideas without having a good sense of local conditions. So thank you very much, or local programs. Thank you. Two quick thoughts there's an organization called Parks Prescription, and very slowly there are doctors. This is based, it's a nonprofit, and it's based in Washington, D.C. Robert Czar is a pediatrician who is a co-founder. And they offer then a website that has the materials and basis for doctors or any healthcare provider doing Parks Prescription. And so maybe that could be something that could be introduced into these systems.
We actually are using that in Palm Beach County. We do those prescriptions in the healthcare district. They're pediatric physicians. At least they used to. I don't know if it's stopped or not, but I'll check into that, make sure they're still using it. We definitely are at the health department.
All right. The second is there's a hospital system in Portland, Oregon, Legacy Health, and they have a series of therapy gardens across their primary hospital as well as some of their other hospitals and clinics. And these are theme gardens. So there's cancer center, burn unit, children's healing garden. Anyway, you get the idea that they're intentionally designed for particular user audiences. And they recently did some research, and what they focused on was not only the patient response, but also staff response. And they found that nurses were less stressed if they intentionally used some of these green spaces for their breaks. And so now Legacy Health offers sort of incentives, activity or programs for people to use, the staff to use these gardens, and they do them 24/7. So I've seen images of music in the garden at 3 in the morning, right? Or games in the garden at 6 in the morning, so that staff who are there at any time of the day or night are welcome to use these spaces and just discover these potential therapeutic effects.
Nice.
Mhm.
Thank you. And we have one question. It's a great one from Eileen. Are there studies regarding bringing greenery in the home or classrooms, office, in the workplace? And you start to touch on that a little bit in your last comment. Any impact there?
So I have, the wide range of research that one can do. I have specifically focused on urban green, and there are lots of wonderful studies about wilderness experiences and wilderness therapy. Also, there are lots of studies about interior landscapes, and I don't know a lot about that. But there's an architecture engineering firm I believe they're located in New York, called Terrapin Bright Green, like terrapin, like the turtle, Terrapin Bright Green. And they promote indoor biophilic landscapes. Biophilic meaning, biophilia is this affinity that we have nature that's derived from our long history as a species, our connection to nature for sustenance, support, and beneficial outcomes, other beneficial outcomes. So you might look at Terrapin Bright Green. And I'm trying to think of other keywords that might pull up information about that. I would just say nature, interior benefits, and you'll find some things.
Thank you. All right, we can move on to the
Abby, I have just one more quick question
Sure.
for Kathleen. So in terms of greenery, planting trees, etc., I know that like in Israel, they have a tremendous like marketing campaign on planting trees there. I don't know if we have it here. I mean, it's tremendous, for every event or everything, and they have built up their greenery, tremendously because of this campaign. I wonder if you can, talk about that or talk about other things that we can do, to get. Now, again, it doesn't have the added benefit of us working there and being in that environment, but certainly building up the green space and trees. It's been a tremendous effort.
I've heard about the tree plantings in Israel. There are other nations that have done similar projects. You may remember a woman named Wangari Maathai, who won a Nobel Peace Prize, and a lot of her activity to promote or to achieve that recognition was about tree planting across her nation. I believe it was Kenya. I will say that engagement, so again, a little pitch for Community Green, that sort of engagement. And what we find is that there are different messages or different hooks for different audiences to help connect them and encourage them to participate in all of this. I have to say, I find that health is, we all are concerned about our own health, our children's health, our parents' health. And so that is often a pitch that is a little more successful than saying urban heat island, thermal conditions, or even, these things that are a little more abstract or not as readily obvious to us. So health is but one important message, but it might be a leading message. I'll also say something you might run up against is, I've done work in other nations. I've done a couple of sabbaticals in Japan and so on. And something really interesting that I've noted is, personal observation, is that Americans, when we think of nature, we think of the national park or the national forest, the big nature with capital N out beyond the city. And we're not as inclined as people in other places to think of small N nature and its importance. So those trees that are immediately around us. So as you message and communicate about all this, to use imagery that, so people in their mind are not thinking, oh, the Everglades National Park, that's what we're working on here. No, it's your immediate environment and your immediate health promoting tree system. So thinking about the messaging and the imagery associated with that.
Thank you. All right, in the interest of time, we'll move on, I guess, to mental health.
Okay. All right, again, the review on trees and health. We did a science quality assessment, and because I was informed there would be some doctors on the call and some people who are in scientists, I thought it'd be important to share this, that we did look at the quality of science. And very quickly. So there are models and cross-sectional studies that are helpful as an indicator of potential health outcome. Correlational studies, you see an instance, a lot of big data analysis now where you can access health data, set something from CDC or other sources, and then remote sensing satellite data about green. And look at those statistical connections. But then when we get into a little more conclusive, a little more defensible science, if you will, are the quasi-experiments, and those are situation or natural experiments, situations not unlike Roger Ulrich's study, where people were randomly assigned. He didn't have control over that, but they were randomly assigned to different rooms and looking at different views out their windows. And then a random control trial, an RCT, and more RCT is happening because we're getting the funding to do this. When I started doing all of this in the 90s, I was working on very small budgets. Thank goodness for the Forest Service starting to launch some urban forestry work. And I frankly did not have the resources, even though I understood the value of an RCT for the conclusions that one might make. I simply did not have the resources to do so. So we're seeing an increase in the character and quality of the science. Here's what we found in terms of topics and strength of evidence. Some really interesting things with regard to cancer, for instance, of late. Pretty hard to track that because there's so many other confounds if you're trying to deduce what is the influence of green around you and the incidence of cancer and or healing. But then we see a little more promise in birth outcomes, diabetes management, asthma reductions, social cohesion, addressing the role of loneliness and its implications for not only our mental health, but our physiological health. But then the green bar, these are the most conclusive results that we saw across the studies. And if you note, a lot of them have to do with psychology and mental or psychotherapy, mental health. And so that's the reason why I'm focusing on that. I could do other presentations that take some of these other themes and develop them a little bit more. For the sake of time, though, I'm going to focus on mental health. And as one, I'm trying to remember, one of our participants, one of our audience members mentioned the value of her garden and her backyard. Me too. During COVID, the isolation, the social distancing, and for me, my nearby nature experiences were invaluable as I wasn't commuting. I was doing so much of this Zooming, as probably all of you were as well. And that of itself can be quite a demand then that can be offset by time in nature. So generally, remember those two high-level messages from the review. There's general wellness that we see in terms of mental health and function, and also therapy. So we're seeing children in school, better school performance if they have more green on their campuses or in the immediate neighborhood. Stress reduction, attention restoration. I'll talk a little bit about that. Creativity, just a handful of studies recognizing that when people have access to nature at particular phases in a project, it helps to boost, it helps to initiate ideas and boost creativity. And then on the therapy side, if someone does go to a care provider and they're diagnosed with a condition of whatever severity, we do see some marginal benefit of having nature opportunities and maybe even prescribed time in nature. All right, here's a few studies, highlights. Stress response. Here's a study, urban adults. They chose their green experience, the time of day, its duration, and so on. and found then that people who were more, had more access or did more access to green, less cortisol. So as a biomarker, a physiological biomarker. And again, you see that 20 to 30 minute potential dose finding. And those people who were least active and then went into the study, which included a modest amount of activity, they responded even to a greater degree. Mark Berman is at the University of Chicago. He's done a number of studies concerning mental health and function. In this one, people who were diagnosed with depression, a group was recruited. Half of them walked the red line through a residential neighborhood, not having as much green. The other group walked through the green line, residential area having more green. This is actually in Ann Arbor where I did my grad studies. And then it was a crossover study. So after a good bit of time, I think it was about a month or so, they did a crossover, which helps to control for the various individual characteristics of people. And they switched then the activity. And what they saw then was improved mood and improved improved attention to task after walking in green. So that's just a sampling of a number of studies demonstrating this positive response if in a state of anxiety, depression, and so on. And why does this happen? Or what might be a causal pathway? A colleague of mine, Greg Bratman, he's here at the University of Washington, and he did a study and he found that people who experience a walk, a prescribed walk, as a study subject or participant, they were less likely to ruminate. And this is a term that's used in psychology about how we can go into a negative thought pattern. What I could have, should have done, what I didn't do, who's responding to me, who's not. And what he found was during these walks and after these walks, people had lifted a bit out of this negative spiral, which then had an influence on mood. And also he was able to do a modest amount of brain monitoring and found less activity in that area of the brain where those sorts of thoughts are generated. There's a lot of concern about loneliness and social isolation as a health concern, in that people who are lonely may be more inclined to greater disease severity, less reduced sort of capacity for healing. There's some studies in cardiovascular surgery about this. So the National Health Service of England now has a minister of loneliness. And I understand that Japan, their National Health Service there recently started a similar program. So there are studies now that are looking at not only walking and potential health benefit, but walking with others and finding then lower depression, lower perceived stress, enhanced positive affect. Group walks synergize with other outcomes. And this might align then with a possible program. Walk with a Doc is a national nonprofit. And healthcare providers agree to do informal walks with groups of patients, answering questions, providing general options or strategies for improving health, and building up a little stronger relationship, say, than that time when you're in the clinic or in the hospital, and that one-on-one that's often guided by the computer and checklists with regard to diagnosis and symptoms. So walk with a Doc might have a possibility here in a variety of ways. Stress response. One of my colleagues, Bill Sullivan, did this study with colleagues, and it was a laboratory, so it was a random controlled trial. What they did was to create these images that have different levels, equivalent residential environments with different levels, percent levels of forest canopy. And here's what they found is the red line is the cover density, increasing up to about 60%. The blue line is stress recovery, not the level of stress, but level of stress recovery. And so you see that with the increase of forest canopy, you see increased recovery. What I found really interesting about this was, you know, there was kind of a point that the blue line is not as straightforward as the red line by intention of the research design. But what you see is there's kind of a point of diminishing returns, kind of a leveling off at about 35–40% canopy cover. And to me, that sets perhaps a policy goal of, okay, health response is working out there about 35–40%. Maybe that's a number that's defendable, in addition to issues of heat stress, in addition to air pollution numbers that can guide health policy with regard to trees. Over time, we have become so connected to screens and to focused tasks, doing a report, writing an article, doing a budget, and that can deplete. And then of course with COVID, that was just magnified, amplified by having to work at home and maybe working with your children who are studying. The image on the left to me just so captures, bottom left just so captures the sort of urgency of, I'm standing up and I'm at the screen and I got to get things done and then I'm going to go. And this then can deplete our cognitive capacity, our ability to attend to these tasks. And this is a lifestyle that's fairly recent in human history. We're an agriculture and agrarian society early on, and now we become a tech society. And that has implications for how we function. A couple of my mentors, Rachel and Stephen Kaplan at the University of Michigan, first studied this attention depletion and then studied the role of nature in recovery, resulting in attention restoration theory. And that is, cognitive fatigue has a wide range of implications for us. We can become frustrated, and that can lead to possible aggression with regard to other people, work, home. It can also impact our impulse control. Some studies suggesting that youth who have attention depletion may not be making as good choices because of a diminished impulse control. As you would guess, nature, these studies suggest that nature is very valuable. Brief times, 20 to 30 minutes, less if you have to, more if you can, quite valuable for attention restoration. And part of that is being away. And this doesn't mean, again, having to go far away to a national park or a big place that's outside the city. It's simply stepping away from that desk, being outdoors, maybe even looking out the window at a lovely outdoor space. There has to be extent and compatibility, the feeling that you are not cramped, that you feel secure and safe within that space. Different activities, maybe you're not able to walk as far. Is there a nice bench? So that compatibility is important. But here's the key: soft fascination. And what that means is nature offers us opportunities to look at things in a way that we can, we don't have to work at it. Nature draws us in without effort. And so, you know, I know in some of your backgrounds, there's a lot of soft fascination there. Different colors, different foliage textures, birds, watching wildlife. Wow, soft fascination. Wind, water. I see one of you has a water feature behind you. Quite a prominent element in environmental preference is water. So looking for and setting up. So again, within healthcare facilities and maybe interiors is how to build those places, design and build those places that offer soft fascination. All right, running a little over time, but
It's okay, it's worth it.
okay. I'll take a break here for any questions or comments. The environmental justice section, more brief, won't take as much time, but if we want to take some questions now, that'd be great.
Thank you. And for those of you who do have to jump off, we'll circulate slides in the recording for what you have missed. So in the chat, there's no direct question, I don't believe. Dr. Alonso shares that locally each city government is responsible for the city codes regarding tree planting requirements. So West Palm Beach, for example, mandates certain landscaping requirements for any new construction. And for city plants with irrigation along sidewalks areas on certain roads, and even at city buildings.
Yeah.
Is
Yeah, just a quick comment on that. Historically, so some of the work I'm doing now includes collaboration with the American Planning Association, and we're trying to translate this research into planning guidelines for professionals who shape our cities. And what we're seeing is, all right, if you want to build a building in a city or build a road, there are national level standards. There's a little bit of tweaking on, within a local government or a county government, but largely, if I walk up to the permitting office in Seattle, or if I walk up to the permitting office in Delray Beach, for instance, I will find fairly similar code to guide how that is done. We don't have that yet in urban forestry and urban greening. And that, I think, is from a historical legacy of nature in cities was seen as beautification. Isn't it lovely? It's aesthetic, but not essential. Well, now we're realizing, because of the ecosystem services such as stormwater management, heat reduction and so on, and then these salutogenic, the term salutogenic benefits, we're seeing that it's profoundly important, but we don't yet have that uniform code. And so I've been in contact with people over the years who are like, what is a model code that any city could use? But we're unfortunately not at the point where adoption or recognition of that, and much less adoption, is very prevalent. So maybe that's something that could happen across the state of Florida. It's a long haul, admittedly, but to make the case that this now merits some sort of consistency in how we promote and apply urban greening in our environments.
Thank you. Wendy from Volo. You're on mute. Thank you.
Sorry about that. I wanted to say thank you, first of all, for the presentation and for your work in community greening and Palm Beach Health to make this connection between environment and health and the importance of that. That's something that we do at Bola Foundation, raising awareness, because it lowers the allergy rates and things. I was just wondering, I attend monthly sessions with the White House for the environmental justice, and so I was just curious if you're getting dollars from IRA. I know they have a huge push with the CJ40, and I know that this is so planting trees. I know that presentation started off with the percentage of trees in lower income communities. Are you all working with them and getting dollars through the IRA?
Thanks for that question. And I think I might have mentioned at the beginning that I'm semi-retired. And part of the semi-retired is I am no longer pursuing grant funding as an investigator, as a principal or co-investigator. But what has been happening is people have been reaching out to me, various teams, organizations have been reaching out to me to be a collaborator, a consulting collaborator on some projects. So I am in touch with some organizations that are pursuing that funding, but I personally am not. I've let go of grant hunting. I'll just say that.
I can, but Wendy,
Yeah.
for here locally,
Yes.
we are pursuing that. So with the Florida Forest Service, we are receiving IRA funding for exactly what you're talking about, for those communities to increase the tree canopy. And then we have a joint application with the Office of Sustainability with the county to do the same thing. So I mean, we really should be receiving that. to start focusing on the low tree canopy. And
Yeah.
yeah, I'll wait till the end of the presentation. I want to talk a little bit more about like what the tree canopy is here in comparison, like you showed that 35 to 40% kind of sweet spot of stress reduction. That is interesting because that's what considered a healthy tree canopy, and we're not really
Yeah.
close to that here. That's the problem. So
Yeah.
Eileen,
Okay, so first of all, this presentation confirms what I already knew, which is dogs are much smarter than we are, because we all know that dogs love to play in parks and out in the yard, and now we know why. But what I really want to say is that based on your presentation in terms of the health benefits, I know it's complicated in many ways, but I think we have the ability to simplify this for the public by more awareness. I mean, some of this is really easy, you know, for people to take a walk, to go to the local park, to do things like that. And I'm not sure, at least I was not clear myself on all the health benefits of this. So I don't know what we can do locally, but I don't think there's enough awareness out there on these benefits, what people can do in a very simple way. So just throwing that out there.
I really appreciate that, because as a social scientist, I sometimes feel like I'm confirming the obvious. And what I have observed is that you touch in terms of messaging, you touch people with sort of these intuitive, oh yeah, I get it. But adding just a level of detail of the research then suggests the legitimacy of policy and broader programs and funding then that can help to create the places that people recognize as being valued. So again, it depends on audience. As you all know, what is the purpose of the messaging, and what do you hope might be the outcome of that messaging? So on one hand, it's individual behavior, what people to choose to do with their time, how much time they spend in nature, but then it elevates to who in individuals or groups might be making decisions about policy. And then you decide where you hit them, reckoning with individual or personal experience, as well as some level of data.
we have one more section to go, and I think there's some rich comments in the chat that we can jump from after this third
Okay.
environmental justice section.
Okay, great, thank you. All right, as Mark called out early on in this hour-plus presentation, and also what we see in the research is a lot of attention to a term that's starting to capture the absence of green in communities, particularly those communities that are socioeconomically more diverse or less income basis, nature deprivation. And to me, that has come about because we've been able to do big data analysis. When I was a young graduate student, the sort of data analysis that produces the maps that were in, say, the Belglade report would take days to do and would involve huge mainframe computers. Now I can do that sort of analysis right on my laptop here. So we can see the mapping, we can see the images that represent this nature deprivation, and that then prompts policy and action. And some of the studies, for instance, this was done a decade ago, and it shows then different cities in Illinois and the disparity, the diversity in tree canopy cover, and then also reflects social disparities. So these maps are a combination of where there's not adequate or less tree cover and those socioeconomic factors. City of Seattle, near where I live, did a study, and what you see is a very loose correlation. It's not absolute, but it is a loose correlation. So the dark green sections are communities of color. The size of the dot within those sections represents the amount of tree canopy cover. And so what you see is a very general, not always consistent, but a very general relationship of places that have more affluent, often white residents and more canopy cover. And the city of Seattle, in recognizing this, has now embarked on a variety of programs to address this at a variety of levels, engaging communities, including faith-based institutions, and tree planting programs that relate to communities' interests, values, and needs. This is prominent in the literature now, research literature, as well as policy literature, promoting green. But then there's the question of what is just green enough? And that question is about, ooh, we have to be careful here or we can trigger gentrification. But I think the core of that is displacement, that people that have lived in an area for quite a while for a variety of circumstances, but if you perhaps introduce more green space, more trees into a community, one can see then perhaps a transition of home and business ownership. So I'll leave you with this. There are people studying, Alessandro Rigolone, I just met him a couple of weeks ago at a meeting at the University of Utah, and he has worked a great deal on how do we green without displacement. And it involves locally based development and capitalization projects. So I'm hearing about remedies for property tax increase so that people are not taxed out of a neighborhood. It includes local, right in the community credit unions, so that there are loan and repayment systems where funds then circulate through the community. And as part of that, work to retain local ownership. There are urban land trusts that are doing really interesting things in buying property and thereby maintaining the appreciation in a way that is more controlled, not limiting it, but maintaining it in a way where people who live there can benefit from this appreciation, but not be pushed out of it by new incoming residents. So I would say it'd be really interesting and valuable for you to pay attention to this dynamic. And it's not only about the trees and parks, that's kind of a signal, a visual signal that change is happening, but it reveals much deeper dynamics of developer financing, zoning practices, land use decisions. So poking down a little bit and figuring out where this can fold into any sort of urban forestry campaign is probably quite important. All right, last thoughts very quickly. Urban planning. I mentioned I'm working with the American Planning Association, and it's complex. How do we introduce this in our city? So Cecil Konynendijk is an international urban forestry scholar. He works in urban planning. He works in community management and trees. He is just saying, it's simple, folks. 3,300, 3,300. 3 trees visible from every home. 30% canopy cover. 300 yards, meters, distance, every person access to a green space or park. Ambitious. Some communities kind of getting there, others, who knows if they ever would. But it's a readily conveyed message about, and he's written an article now, a peer-reviewed article about the evidence that supports these numbers. And I realize I don't have the citation there, but I could share that if you'd like. Final idea, reading all of this research, thousands, literally thousands of articles now from all over the world about nature experiences and health. I'm realizing nature experience is not unlike nutrition. We love a memorable feast, Thanksgiving, maybe a special event where we dine with a group of people, have fun, and it becomes kind of a milestone in our lives, either for a short period or across our entire lives. We also enjoy the occasional nice meal at a restaurant. It's a highlight, a treat, but what we need is nutritious everyday food. And I've seen that we need high quality nearby nature around every home and available to every person. So we can talk in this metaphor of nutrition and nearby nature, the need for it that is now evidence supported. So I'll end there. And again, a little over, but I think we have a little time for discussion. If any of you have any thoughts or questions.
Yeah, excellent presentation, Dr. Wolf. Thank you so much. And the variation, the variety of what you've covered in a short period of time is very, very helpful and compelling. Any questions before I kind of summarize some of the chat? Alita was sharing just an observation and looking at flying into New York City, the metropolitan area, and noticeably seeing the change since she was there as a child growing up. And Andy, who grew up in New York City, just walking into Central Park and noticeably experiencing the cooling effect and what that does.
Yes.
And then Dr. Alonso, and Mark, you can speak to this in the community greening model. You know, her observation about you can plant trees, but you also need to steward those trees. And I think that's part of what's so unique and special about the community greening approach. If Mark, you want to talk a little bit about that.
Sure. Yeah. No, I agree. I mean, from the very beginning, we knew we couldn't have an urban forestry nonprofit if the trees weren't surviving. And that was the biggest hesitation of people partnering with us from the very beginning. Of they've seen other groups plant a lot of trees and then they die. So really we modeled after other groups, and we it's a workforce development piece of what we're doing. And not even just that, I mean, we're hiring people to take care of trees. So tree technicians, we have an arborist on staff who's our urban forestry director, who's growing up trees in the nursery to ensure they're healthy, and then also overseeing the maintenance of the trees. And so we're trying to hire people get from low tree canopy neighborhoods, and so that's like a big goal of ours. A focus of ours is really hiring people. So and then we also have a youth tree team. So the youth tree team is teens that the U.S. Fish and Wildlife Service funds primarily to maintain and take care of the trees and plant trees. So the teens are working with us 30 hours a week in the summer. They're, you know, teenagers making 11 to 16 an hour, being driven around by a staff person. And that staff person then is a former youth tree team member, along with another person that, you know, was, some of you know Dupree Jackson, who was on this call a little bit ago with the EJS project. It was a teen that came from EJS that was on the youth tree team, and now he's a full-time employee with us. So that's kind of like Dr. Wolf's point at the very beginning of how crucial it is to engage the community in this. And then that's even to the point of hiring people in the community to maintain the trees, and the volunteers planting them too, having that connection. So, and you know, we're not always perfect. Always there's trees that are going to die, or there's the wrong species, or, you know, tough drought conditions or something like that. But and that's kind of what we're doing. And just one other piece while I'm talking, what I wanted to say about the presentation is that 35 to 40% tree coverage, to talk just a little bit of numbers, that's really what started this whole thing in Delray Beach, because it was a 23% coverage. So we learned that it had a 23% coverage. Certain neighborhoods had 16, others had 44. And so they set a goal of planting 10,000 trees in the next 5 years. So community greening has that contract, and we are planting, we've planted 4,000 or more in Delray Beach, and the goal is to get up to 10,000, to increase it to 28%. So like, as Dr. Wolf showed, a healthy tree canopy is normally, you know, what people say 35 to 40%. And just to kind of continue on that, where we're at is like Boynton Beach is 16%. Boca, you'd imagine, is a little higher, 26%. But then that's when we really learned, when we went out to Belglade, because Palm Health was encouraging us to expand our programming there. And we found out it was, 4% from a study done by Green Infrastructure Center. And so, I mean, if we were concerned in Delray at 23% or Boynton at 16%, and then seeing where they're at in Belglade, and this is really comparing to other cities, like Atlanta has a 47% canopy. Washington, DC has a 35% canopy, even Tampa Bay, 32%. So you're getting a little bit closer to that, that healthier. Savannah's in the 40s too. So, I mean, you're noticing these if you go visit Savannah, that there's a lot of green space and tree coverage. But I mean, that's kind of the issue of where we're at down here, is that we do have very low tree canopies compared to other places. And that's the goal, is really to get people together to create these campaigns and plant the trees. Hopefully, some of this IRA money, the Inflation Reduction Act that Wendy was mentioning, hopefully that is going to come here, and that's going to help us a lot by giving away trees and planting trees. So, but we've planted 12,000 so far in 7 years, and we need tens of thousands, if not hundreds of thousands of more trees to really increase the canopy in Palm Beach County.
Dr. Wolf?
A quick comment on that. So over the years, again, because we can do this remote sensing and detect canopy percentages and the nature deprivation, the areas that don't have many trees. As an environmental psychologist and reading this science, another trend that I'm seeing is, can we move to the next level below or above, depending on your point of view, with regard to tree canopy. So tree canopy is a very coarse grained sort of expression of the amount of green in a community. I've been working with some people at the University of British Columbia, also this American Planning Association collaboration. We're trying to determine, how do you place those trees? So yes, the Belgrade report, for instance, had a map of plantable spaces, but within that, how do you position trees to enhance these health experiences? So the soft fascination is a way to cluster trees in a way that creates spaces where people can find soft fascination. Another idea we're exploring is thermal refuge. So if you have these high heat events, air conditioning, you can't stay inside for days or weeks on end. You have to go outdoors. And can we plant trees in ways that create groves that become the thermal refuge, that are of determine what is a minimal size where you can go in and feel that cooling effect that was mentioned about Central Park. And that's different than infill planting in a kind of randomized way. So thinking about then all of these health outcomes, are there ways to introduce trees into neighborhoods in ways that reinforce potential health outcomes? Having canopy, great first step, but what might you do? And that's where landscape architects, garden designers, and so on might collaborate then with the people with the arboriculture and urban forestry background to explore those possibilities.
It's fascinating. I'm learning some really powerful new terms from you today. Carrie's asking about, there is a large correctional facility in Belgrade. Has work been done on mood for inmates with more nature, to have more nature around?
Wow. I have a colleague at the University of Utah. Her name is Nalini Nadkarni, Nadkarni. And you may want to look up, she's done TED Talks and whatnot. She's primarily a tropical forest ecologist, but she was once a professor at a university here in Washington State. And she started the Sustainable Prisons Project really quickly. She is doing ecological restoration across the state. They need butterflies, they need mosses, they need grasses. And she's like, how do we do this? My students can't do this. So she went to the corrections director for the state and said, you got a bunch of people with a lot of time on their hands. Might they grow things? And he first said, are you kidding? Get out of here. But she persisted. And then, so I have visited a high security correctional institution here in Washington State because the Sustainable Prisons Project and Nalini asked me if I might introduce some social measures into the project. Now, so there are now prisons all across the country that have adopted this model. And in addition to that, Nalini has worked, I forget which state it was, but she introduced large format digital screens into break rooms for those who are incarcerated, and found improved mood and less aggression on prison staff. So yes, there's been just a little bit of work, much of it done by Nalini, but greater interest in this as a, again, not eliminating behavioral issues, but perhaps complementing other behavioral interventions.
Excellent. That seems like a whole sector.
Oh, totally.
Potential, yeah.
Yeah. And there have been studies over the years. At one time, jails, for some reason, had a good bit of land, and I'm not hearing about
Yeah.
this as much, but jail gardens where inmates are growing food. They're learning, again, workforce skill development. So when they leave, potentially jobs in green industries. I'm not hearing as much about that, perhaps because the character of jails and prisons has changed in recent decades.
Well, you have some nice love in the chat, a lot of gratitude for your comments today. We have just a couple more minutes. If there's any other comments, if anyone wants to come off mute. Dr. Alonso is the retired director of the health department, just retired, and is receiving a Lifetime Achievement Award tonight, or today, or this week, I think, with the Palm Beach County Medical Society. So thank you, Dr. Alonso, for being here. Your insight is invaluable. And it sounds like you're ready to get to work. So we in the community greening team will remember that.
This has been right up my alley, and you know, I guess I will never lose my public health duties one way or the other. So don't worry, I'm involved in this, and thank you so much. Wonderful, wonderful presentation. Best one I've ever heard.
Wow. Dr. Alonso, I would guess. So my retirement was not a cliff. It's a very, very long glide is what I'm discovering. I have a feeling you're on a similar path.
Absolutely.
Mark, is there any closing thoughts from you or Adrian?
No, I mean, it's just, this is kind of what I was imagining and more. So it's just really nice that it's, sparked so many thoughts on what we can do here in our community and everything that Dr. Wolf covered. So it's, there's just so much work to be done, and I appreciate everyone who joined and stayed on. And it was, it's a nice group that I think we are going to take this energy and everything we learned today, and it's going to have an effect on our community too. So I really appreciate it. Appreciate Palm Health and appreciate your life's work, Dr. Wolf, and sharing that with us. It's going to make an impact here. So,
And Abby, please get the slides. I think we'd love to have them. Yeah, thank you.
Yeah, will do. And one of the things that one of the many takeaways, Dr. Wolf, is I hear a lot of hope and possibility in your comments, and that brings me a lot of comfort. While we have a long way to go, through the course of your career, the knowledge that we are able to build from is really exciting. So thank you for being here. And thanks everyone for your time today. And we'll send the slides and the recording.
Thank you.
Thanks, Mark. Thanks, Adrian. Bye-bye.
Thank you.